Hey there, my name is Laura Massey, and I am a student with Gardner-Webb University completing my bachelor's program. And today I am bringing you my project that I've worked on this semester about medications. One thing we want to talk about is polypharmacy and exactly what polypharmacy is. It is designed or defined as 4 or more medications that a patient takes on a daily basis. So if you think about, a lot of patients probably take at least 4 or more every day, especially when you start having multiple illnesses like congestive heart failure, high blood pressure, diabetes, things of that nature. So as many as 45 to 49% of adults age 65 and over tend to take prescriptions of at least 5 or more pills per day. And it's interesting, during my clinical rotation that I've done, is finding out how many of these patients that don't really know what exactly they're taking these medications for, much less even knowing what the names of them are. So that was another concern that I saw as well. Some patients say that when they go to their doctor's offices, that a lot of times they don't bring their medications with them, or they don't bring a list of the medicines with them. And some doctors report that their patient says, oh, I just take this little pink pill, or I take this white pill, or so they don't know what medications that they're on. Other things that are overlooked is over-the-counter medicines, like things like Claritin, which is an over-the-counter now, like for allergies. Aspirin, people take aspirin once a day to help with prevention of blood clots and strokes. So, and the other issue we have is that many people see multiple doctors. So you may have your regular primary care doctor, and then all of a sudden you go to start seeing a cardiologist who of course treats your heart, or you might see an endocrinologist who helps take care of diabetes. So without all these doctors knowing what medications each prescribe, there's times when you may have multiples of the same type of medication, like you may have multiple of the same type of blood pressure medicine, or it may be your primary doctor will tell you, well, I'm going to give you a name brand medicine, then your cardiologist will tell you a generic medicine, and they're both the same drug. It could be that they got them filled at 2 totally different pharmacies, so it's really hard to tell from time to time what these medications were. One thing to help kind of cure some of that is when you do go to the doctor, is that if you could take your medicines with you, or if you need to, try to get your caregivers or your children or spouse or your significant other maybe to help you write a list, especially if you have multiple medications that you take every day. So with that will definitely help as being able to cut down on some of the duplications of medications. Another reason that we are concerned with the medications too is because of compliance. Some patients just simply quit taking the medicine because I'm just not taking it anymore. I don't like the way it makes me feel, or it's too expensive, I can't afford it. So there are things out there that we can help with as far as medication costs. So things to think about with non-compliance, which that is called, is by bringing all your medications to your doctor's visits, each doctor's visit, whether it be your primary care, the emergency room, urgent care, your specialty physicians, making sure you bring those with you, or if not, making sure that you bring the list with you. And in these medications, you need to make sure that you bring all your over-the-counter medications like Tylenols, aspirins, allergy medicines, things of that nature. Let your doctors know your financial ability to pay for medications. There are many options that are out there. A lot of drug companies have programs that can help get some medications free. A lot of times it's based on financial abilities. There will be many forms sometimes you have to fill out, but a lot of times your doctor's offices can really help as far as getting these forms expedited, or maybe be able to talk directly with the drug companies themselves. Always ask about side effects. What is to be expected of this medicine? Like some medicines give you diarrhea. There's some cholesterol medications that we take that can cause your stools to become very loose. And some patients just do not like having the diarrhea. So that's something to talk to your doctor about. Is there an alternative that you can take to kind of minimize some of these side effects? And then also, always ask what you're taking this medication for. It doesn't hurt to ask what the name of the medication is as well. I've been with my grandparents many years ago to their doctor's appointments, and they said, I'm going to write you this prescription for this medicine. take it to the pharmacy and they'll tell you, how you need to take it. It doesn't hurt to ask them, well, what is that medicine that you're giving me? What kind of side effects can I expect from it? What kind of things do I need to call you for in the case that I do have a side effect that you need to know about? So these are some things that would really, really help. And especially helping with compliance too, because if you know what's going to be expected to happen, you might be a little bit more apt to taking the medications as been prescribed. The programs that I was talking about a little bit earlier were discount programs. A lot of your major pharmacies have discount programs that are out there, like Walmart, Walgreens, CVS, Rite Aid. A lot of these have $4 prescription payments. I think like Walgreens has like a once-a-year fee that you pay to join into the prescription program, and then their 30-day supply of medications are $4. Walmart, I think, is a free program. A lot of these are free to join. They just basically need your information and put you into their computer system, and when you get your generic prescriptions filled, they can get you at a discounted rate. If that's not helpful, there's also other drug companies. On the pamphlets that I have out here for you guys, on the very back, there's all these different patient assistance programs. Abbott, GlaxoSmithKline, Johnson & Johnson, Merck, Pfizer, those are just a few of the programs or the drug companies that have prescription programs that are available for patients as well. So always, speak with your providers. Always, talk to them and let them know when you go to visits. Let them know how things are going. This has been happening to me. These kind of side effects have been going on. Maybe these may be some unwanted side effects. Maybe these are some that that you really didn't, or they really didn't want you to have. So by talking to them and explaining to them what's going on, it would really help. So I've got plenty of these pamphlets out here for you guys. If you know some other folks that could benefit from them, please help yourself take you a couple with you. And I really do appreciate you guys letting me come in and talk to you today. Does anybody have any questions? Okay. I know it's kind of short. I did have an audio visual, and unfortunately they didn't have a computer system here that I could use. I wish I would have had that with me too. But alrighty then. Like I said, thank you very much, and I guess I will let you you guys get on to the rest of your meeting then. Thanks.